Then cerebellar nuclei, what do they basically supply? Globose emboliform dentate, they are all associated with cerebellum. But lateral geniculate, medial geniculate, what is their importance? Lateral geniculate body is important for our vision or audition? Eyes are medial, but lateral geniculate body is responsible. Medial geniculate body is medial, but the ears are lateral. Similarly, superior colliculi is important for vision, inferior colliculi audition. Lateral geniculate bodies for vision, middle geniculate bodies for audition is what you are going to ultimately remember. Now shoot me an answer, doctor. One topic which you can never miss it before going to the NEET PG is ovarian tumors. That's my focus for this week. When you come down on next Sunday for a discussion, by that time I will give you a solid list of 500 topics. Just read it and go to the exam. If the 240 questions come outside those 500, you can hold me responsible. But if they come within that 500, still you did not answer, can I hold you responsible? No one can hold anyone responsible. So, doctor, who is going to give me correct answer? That's right, we get the granulosa cell tumor. Most of our students from Vizag, Dr. Samira, Dr. Chandrika and Dr. Vidya, that's right, granulosa cell tumor. If you look at the CSF, it is not the main source of nutrition and the remaining things supply. Now, how is respiratory acidosis compensated? By the kidney. Metabolic compensation. Kidney will retain bicarbonate and try to compensate the respiratory acidosis, which is the main mechanism. Both respiratory and also metabolic alkalosis, they are known to lead to development of tetany. Why tetany develops? Because when the pH of the blood becomes alkaline, the negative charges on the albumin will increase, and that will attract more calcium which is positively charged to be bound. So the free ionic calcium levels will come down, and that lead to development of tetany is what you have to remember. It is a skeletal muscle where whenever we are exercising, there is a release of the local metabolites which will typically increase the blood flow. So the skeletal muscles is what need to be remembered. Pulmonary vascular resistance is typically less than 1/3 than what is offered by the systemic circuit. As all of you know, that in the pulmonary circuit, the pressure which is driving, the pressure head which is needed to drive the cardiac output through the pulmonary circuit is 15 millimeters mercury, is very, very less than what is required in the systemic circuit, where at least 90 millimeters mercury pressure, unless it is available, the blood pumped by the left ventricle cannot push into the systemic circulation. Now give me one confident answer, doctor. Breast cancer, topic number 2. Now the time is, the idea is, how many more days before November 22nd? Say November 20, October 10th, 40 days. So every day 15 topics, sure. अगर पढ़े तो आना है एग्जाम में, और कुछ भी नहीं पढ़ना छोड़ दो. 40 into 12 to 15 topics every day. Must sleep nicely, retain whatever you read a little, but read what is going to definitely come, and no more innocence and ignorance in the exam. Hey, breast cancer I did do wrong, prostate cancer I did do wrong, then what are you going to do right? So tell me, doctor, who is going to give me correct answer? Very good. Everybody say fibroadenoma. Fibroadenoma is not a precursor of breast cancer. It is small, mobile, firm mass with sharp edges. Breast mouse it is called. If you want to feel it, don't try to feel it. Ask patient to show it. Then she will hold and say, doctor, please check here. Here it is. Now, intraductal papilloma. It arises from the lactiferous ducts, typically beneath the areola. It has an increased risk of cancer. Phyllodes, some of them can become malignant. That's the reason fibroadenoma is free. What is the meaning of first heart sound? First heart sound is because of the closure of the AV valves. When the AV valves get closed, typically what will happen? The ventricles will contract and start pushing the blood into the aorta. So systole will begin. Hence QRS complex will appear. And when the AV valves got closed, the atrial pressure will rise, ventricular pressure also will rise, but not the A wave. When will A wave occur? It is because the contraction of the atria at the end of the diastole, ventricular diastole है ना, last 1/3 of the ventricular filling. How will first 1/3 of ventricular filling occur? The moment AV valves open, blood will run. Second 1/3, atria higher than ventricle, hence gravity will pull. Third 1/3, atria contract and push the blood into ventricle. And A wave will occur. After the diastole is over into the ventricle, AV valves close. So the A wave end होते ही first heart sound सुनाई देगा. The A wave will not occur after first heart sound. First heart sound will occur after A wave. That's what we need to basically appreciate. Now what is isovolumetric contraction? Basically, when ventricle has to push the blood into the aorta, what should happen? First it should get filled with blood. Diastole it is called. End of the diastole, AV valves close. Even aortic valve is closed. Then ventricle will contract. Pressure will rise sufficiently that it will lead to development of opening of the aortic valve. So that is the reason during isometric ventricular contraction, there is no flow of the blood from ventricle into aorta. If there is no blood in the aorta, coronaries won't be filled. Hence the left coronary blood flow will fall down at the time of isometric ventricular contraction is what need to be remembered. How is the pressure in the aorta? When there is no blood, it is typically low. How is the pressure in the atria? When the ventricles are in isovolumetric contraction phase, what are the atria doing? They are getting filled by passively by SVC, IVC. Hence their pressure is building during that time. That's what we need to basically understand. Now if you give adrenaline or noradrenaline, there is one blood vessel, renal vessel, on which both of them have got similar effects is what need to be remembered, and both of them will decrease the renal blood flow is what I want to underscore. During early inspiration, typically what will happen? There is a fall of intrapleural pressure to negative value, which is the sucking pressure for the air into the lungs. Intrathoracic pressure will fall, pressure in the SVC will fall, all of them basically will fall during early inspiration, is what you have to fundamentally appreciate. Once there is an emphysema, the lungs cannot be able to expel all the air at the time of expiration. Hence residual volume will increase. Lungs become hyperinflated. Hence residual volume increases, not decreases, is what you have to remember. Shoot me an answer, doctor. Let me wake you up. Malignant breast cancer. What is the single most important prognostic factor? And most often, in which quadrant is it located? Who will give me the confident 2 answers punched into the chat box? That's right. Dr. Kirti, Anantapur, everybody said upper, outer. Upper, outer. That's good. Then what is the single most important prognostic factor, doctor? Any day? Axillary, lymph node status. That's right. So axillary lymph node status is most important, most often in the upper outer quadrant is what you have to remember. Now once there is COPD, this is another sure short item, not topic, item. So just like in a movie we have heroes, we have item songs, we have regular songs. Entrance also, some items are compulsory items. Like in a marriage food, a sweet laddu, jalebi, compulsory rahega. Differences between obstructive, restrictive lung disease on spirometry. You can take it granted. ये क्वेश्चन कंपल्सरी रहेगा, which you need to answer confidently. Basically, you have any UPS problem? Then put off the audio. I mean that one. Is it okay? All right. Now, typically the vital capacity is reduced in COPD. Is the voice okay? By slowing the flow. Even restrictive lung disease also will decrease and restrict the volume, is what you have to ultimately remember. If you remove one lung, what is it going to reduce? It is going to reduce the residual volume. It will reduce the residual volume by at least 1/2, is what you need to remember. Whenever the CSF pH is reduced and acidotic, what is the immediate response? Typically, it leads to hyperventilation. That's the reason uremic acidosis, diabetic ketoacidosis, all these people, where will they ultimately land into? They land into hyperventilation, because the systemic pH will in turn will lead to development of a low CSF pH, is what you have to fundamentally remember.